Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
Welcome, welcome, welcome. We're glad you joined us on Heart of Health Live. We have a topic today that everyone will want to tune in for. And if you've joined us the last few weeks, you know you want to get your call in early. And our live phone number is 855-644-3278. And we're going to be talking tonight about cardiology, about the heart. Specifically, if you have questions about interventional cardiology, stents, angioplasties, heart attacks, those would be great questions. But if you have any questions whatsoever regarding the heart or any other topic, we'll try to answer your questions. Our guest this evening is Dr. Sam Ledford, a great cardiologist that's actually served our country for over 20 years in the Navy as a physician before coming over to practice in private practice. He's an interventional cardiologist. You know, over 600,000 people suffered a death from cardiovascular disease last year. It was a leading cause of death along with cancer. So it's something that we need to talk about. And something you might learn here tonight might help you prevent a heart attack or understand what's happened to your body or even know how to use medicines correctly. So we want you to give us a call. Our phone number again, 855-644-3278. Or you can go to our website, that's heartwiseministries.org. On Heart of Health, we just are so humbled that you allow us to come into your home. And I know many of you are channel flopping right now away from the news. Well, don't have to watch the news. You know that's just a repeat of what happened yesterday. Well, come learn something about your health, some way you can feel better and do better. Well, that's what we're trying to do. And Dr. Ledford has agreed to give his time. He's not getting paid for this, and he's going to do the best he can to serve you by answering your questions regarding your heart. So give us a call, 855-644-3278. We have a lot of calls from our website, but we want to hear from you on Heart of Health Live. So don't go away, grab a glass of water, come back. Dr. Ledford will be introduced right after this short break.
Heart of Health Live will return in just a moment.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's one every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
I'm Dr. James Marcum with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thicken, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in two, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Marcum is doing in your area, visit heartwiseministries.org.
Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live, and we'd like to introduce Dr. Sam Ledford to our audience. Sam, we're glad you're here on Heart of Health Live.
It's a pleasure to be here. It's an honor.
And tell me, what got you interested in cardiology and practicing medicine? How did it all start with you?
I started as a Navy corpsman and saw lots of sick people. But interestingly, in the military, we take care of not only active duty, but retirees.
Okay.
And so I had the great privilege of meeting World War II veterans who, at this point in their life, were beginning to have heart disease.
Okay.
Amazing group of people, but I began to recognize that there were great frontiers developing in cardiology, more than just using medicines. And I became excited about what the potentials were. And that led to study and the opportunity to go to a cardiology fellowship ultimately, and knew that I could make a difference in people's lives.
Now, were you always interested in medicine, or did you just sort of evolve into that?
I have no family members who are physicians in the family, no real medical background with anyone. I was just always intrigued with the opportunity to help people. I've always enjoyed being around people.
Okay.
I enjoy talking, and I enjoy tinkering with technology. And cardiology and medicine were the perfect combination.
Now, you had to go to school for quite a while to become a cardiologist, correct?
It's depressing sometimes when I think about it.
Just tell everyone, just so they know that you know what you're talking about.
Sure. So, bachelor's degree like anyone, then medical school for 4 years after that.
Okay.
General internal medicine training, and I practiced as an internal medicine doctor for several years.
Okay.
General cardiology training was 3 additional years after that, and then an additional year in the specialty of interventional cardiology.
Wow, so that's quite a few years of training, and yet you look so young.
Yeah, I'm not as young as I look. You're kind.
Well, give us a call here on Heart of Health Live. We're 855-644-3278. And I got a call from North Carolina. Billy, you're on the air with Dr. Ledford. What's your question or comment for Dr. Ledford?
Yes, sir. I had a quick question for the doctor. I had a stress test done back in 2011. And I have heart disease that runs in my family, and what I'm trying to find out is how often should I have a stress test, and what's a good calorie count diet to lose weight and remain heart healthy?
So the first thing is the answer isn't simple to how often you should have a stress test. If you don't have known coronary artery disease, you've never been documented to have these blockages in the blood vessels of the heart, then potentially every few years. That's based on what your risk factors are. They include family history, if you have diabetes, hypertension, or high blood pressure, if you smoke. And so really your family doctor can help guide you. If you're active, physically active, and you've had a recent stress test that was normal, you can also use your activity to kind of guide you. If you begin to have symptoms suggestive of heart problems, chest discomfort when you exert yourself, worsening shortness of breath, those would lead you to get in sooner to see your physician. So the quick answer is your doctor will help guide you because there's some specific guidelines based on everyone's individual risk factors. Probably for you with one recently and not having known coronary artery disease, probably no more frequently than every 3 to 5 years if necessary.
Now, he also asked some general principles for a healthy diet for heart patients.
So the first thing is we eat far too much fat in our diet. So fast food is a terrible thing. There is nothing in a convenience store that you want to go in and buy, unfortunately. Get your gasoline and head home after that. Eating vegetables, less red meat. using more exercise. We don't talk about that as much when we talk about diet, but it's a key to staying healthy. A calorie count is unique to everyone, again, based upon what their height and their weight are, and based upon some other factors, including some other health issues, whether they have diabetes and etc. The one thing we know is regular exercise and a healthy diet are good. Yo-yo dieting, you know, people who go and take lots and lots of supplements, they go into very low, ultra low calorie weight loss programs. Those people yo-yo, they lose their weight quickly, which is unhealthy, and then they gain their weight right back. The great majority, over 90%, gain all their weight back. So we want you to get out and exercise. We want you eating more healthy, and a simple thing to do that without cost to you is beginning to read labels. Eat less fat and eat more healthy and fresh vegetables and fruits.
Wow, that sounds good. You know, it's dinner time right now across a lot of places we're broadcasting, so hopefully everyone will go in and get the veggies first and eat. I tell people eat just all the veggies first and eat just enough of the bad stuff to be happy.
That's right. Moderation is the key.
Yeah.
You don't have to do away with the things you love. I'm a Southern boy. I grew up in South Carolina. Everything was fried when I was growing up. We need now not to fry anymore. We need to broil and bake.
Well, Dr. Ledford, we're going to go break. Give us a call, 855-644-3278. You're talking with Dr. Ledford, and we're answering your questions about your heart. Stay with us on Heart of Health Live.
The Heart of Health Live will return in just a moment.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing? I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Nice. No. Come on. Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. In our last section, we had Bill from North Carolina had an excellent question about treadmill testing and eating a healthy diet. And you know what? We all need to work on a healthy diet, eating the good foods, having a good balance. Dr. Ledford, we have some questions that come in from our website, and we're going to answer one of them right now while we're waiting for some more calls. And if you want to join us, 855-644-3278. Our first call comes from Illinois, and it says, when would a stent, I guess a cardiac stent, benefit a patient, and how do you know what type of stent to place? So let's just talk about, when would you want to put a stent in somebody?
So the guidelines for stent placement really have to do with symptoms.
Okay.
When symptoms aren't relieved with medications, first medications, and if medications fail, or if patients have progressive symptoms, dangerous, life-threatening symptoms like a heart attack,
Okay.
there's no question you need to treat that acutely, take care of the problem, and then deal with the issues of prevention and things like that after. So a stent provides a means of just simply opening a blocked vessel and improving blood flow to the heart.
Okay.
Medicines can help with that to some degree, indirectly. The stent directly opens the vessel. It's like opening a clogged pipe. The next question, I'm sorry, was
They
what
want to
types
know,
of
yeah,
stents?
what type of, and I assume that they're made of, what are they made of?
So we have stainless steel stents,
Okay.
chromium, titanium combinations, lots of different things. There's some new research even in a bioabsorbable platform. It goes in a matter of months, it may go away completely and take care of the vessel. But the two main things that people probably are interested in are what we call bare metal stents and then drug-coated stents.
Okay.
Bare metal stents are just that. They're the metal. They're a scaffold to support and hold open the vessel. The shortcoming of bare metal stents is in 10 to 20% of people, scar tissue can form within those stents within the first 6 months after the stent.
Okay.
The vessel can re-narrow and they can have recurrent chest pain and symptoms of angina or heart-related pain. The drug-coated or drug-eluting stents were developed to try to decrease the risk of scar tissue forming within the stent.
Okay.
And they're excellent at doing that. The price we pay for those drug-eluting stents is the healing process inside the vessel takes much longer. So patients need to be on a combination of mild blood thinners instead of for only a month after a bare metal stent, usually for a minimum of 12 months or 1 year after a drug-coated stent.
So how do you decide, this guy's having a heart attack, how do you decide what stent to put in?
It really has to do with several things. Really, the first is the size of the vessel, how long the narrowing is in the vessel. We know that the larger the vessel and the shorter the narrowing or the blockage, the less likely there is for less likelihood for scar tissue to develop within a bare metal stent. So it would be safe potentially to put a bare metal stent in those patients. Everyone doesn't have to get a drug-coated or drug-eluting stent. There's no question that in the face of a heart attack, there's a greater risk of blood clot formation. And so we simply need to clean out the clot, open the blockage, and get something in to restore flow as quickly as possible. So we can use either of those depending on what we call the anatomy, if you will. What the vessel looks like and what the likelihood for scar tissue to develop is. And that's the goal, to minimize that scar tissue development once the stent is placed.
Well, for those of you who haven't guessed it, Dr. Ledford is one of my partners. And one time he put in a stent in one of my patients and he decided to put a bare metal stent in because he had to have surgery on his shoulder, which was dislocated the next month. And he didn't want to wait a year.
Absolutely. There are clearly reasons that we have to put in non-drug-coated stents or the bare metal stents. There are patients that, for instance, require blood thinners lifelong.
Right.
We know the combination of these different types of blood thinners that we use for stents in combination with a very potent blood thinner dramatically increase bleeding risk. In those patients, we wouldn't want them to be on 3 different blood thinners for a full year, and so that would be a reason to put in a bare metal stent.
Right. So I hope that answered that question, and if you have a question, give us a call, 855-644-3278. You can talk to Dr. Ledford, ask your question. He'll handle almost any question regarding heart disease. Also, you can join the discussion if you want to join us on Facebook. You can be our friend on Facebook, or you can give us an email at our website, heartwiseministries.org. We have another question that's very similar, a follow-up on that one, and this one's come in. It says, I've been on Plavix for a year after my stent. So we'll assume that it was a drug-eluting stent. I have no other medical problems. Would it be reasonable to ask my doctor if I could come off this? I live in a small town without specialists. So it looks like this person got a stent somewhere else, went back to a small town, and been on it for a year, and the doctors are scared to take him off Plavix that the cardiologist put him on. So this is a real good question here.
So these
I'm going to have to go to break.
That's okay.
That happened so fast. We're going to answer that question right after this break with Dr. Ledford. Stay with us.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
I'm Dr. James Marcum with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thicken, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in two, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Marcum is doing in your area, visit heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
You know, we do have answers. I hope they're the answers that will help you out. But give us a call. I'm Dr. James Marcum with Dr. Ledford, 855-644-3278. Dr. Ledford, before I forgot, we were running out of time. We had a patient that's called in and they've been on stents, Plavix for a year. Would it be reasonable to ask their doctor if they could come off this? Is that a reasonable thing to ask?
So absolutely, whether they have a bare metal or a drug-eluting stent. If the guidelines suggest that definitely with drug-eluting stents, a minimum of 12 months, if you can tolerate that. It is typically given in combination with an aspirin. And so we do recommend, however, lifelong aspirin at a low dose, a minimum of a low dose, about 81 milligrams. That's a baby aspirin. But there right now is no data in most patients to suggest that there's benefit in taking Plavix or these medications for longer than 1 year. There are some exceptions to that, so no question, go visit with your doctor. Don't just stop the Plavix this evening.
Yeah, you know, in my practice, and sometimes people that have lots of stents or stents in small vessels, or they might be a diabetic or continue to smoke, then I says, well, there's no evidence, but we might want to keep on it as long as you're not having a side effect. So there's all sorts of variances.
That's why we call this the art of medicine, or the practice of medicine, because there is not one absolute answer for every patient.
And I had one patient once, Dr. Ledford, that really they didn't have any reason to be on it, but they were so scared off of it. I said, you know, the feeling of scared, the adrenaline, the cortisol, the leukotrienes, and all that activation, it might benefit you to stay on it as long as it's not causing your problem, because they were so panicky of being off the medicine.
I think that's not an unreasonable thing.
So it's
once you're diagnosed with heart disease, you become anxious and worried about that, and rightly so.
You're scared.
But it also motivates people to continue doing the right things they need to do.
Yeah, that's good. Now, we still have time to get your call in, 855-644-3278. And we're going to go to a very important question now that's come into our website. And this is one that I think everyone needs to listen to. If you're on the couch smoking a cigarette, this is something you might want to listen to. It says, what can I do to lower my risk of heart attack? I have a very strong family history. So we want everyone to lower their risk. What can they do, Dr. Ledford?
So you take those things that are modifiable.
Okay.
If you smoke, quit smoking. If you are overweight, lose weight. We're not talking about losing hundreds of pounds. You lose 10 or 20 pounds, a small percentage of your overall body weight, that's heart healthy. Great. If you're inactive, get out and begin to exercise. We know that's protective. If you have high blood pressure, if you have high cholesterol, if you don't know what your numbers are, you should know your numbers, your blood pressure numbers, your cholesterol and your lipid numbers. Go see a physician. Be tested for those things, because lowering your blood pressure and controlling your cholesterol and lipids will lower your blood pressure. Will lower your heart attack risk.
Yeah, and these things are so important, and a lot of people out there don't know these things. You know, a lot of people, I had one gentleman one time that called in and didn't really realize that smoking really raised his risk of not only heart attacks, but cancer quite a bit. And when he found this out, he quit smoking right away.
Men are pretty sneaky when it comes to tobacco, and that is, they think, well, Dr. Ledford told me to quit smoking, so they start using smokeless tobacco. Very common in the southern United States. Well, tobacco in any form, no matter how it's taken in, is just as high a risk for heart disease and heart attack. Whether you smoke it, dip it, it doesn't matter.
Now what about, you know, they've just legalized marijuana in some states. You know, that couldn't be good for your heart, could it?
We have no medical studies, but there's no question that from a lung standpoint, we know that inhalation of these agents is difficult on the lungs. We don't know about the heart. We do know that there may be stressors related to these medicines when they're used, and so I can, in good conscience, legally or otherwise, in whatever state you may be in, recommend that you begin to use therapeutic marijuana for heart disease.
Yeah, but okay, so I hope everyone paid attention to that answer, because it's very important. Now we have about a minute to go before break, so Susan, stay with us. We're going to be right back after your break. We're going to come back to your question for Dr. Ledford, so stay with us. Dr. Ledford, that's great advice. Out of all of those, you know, if they said I could only do one to start with, if they said I do all those things, where would you tell them to start?
You mentioned the guy who's sitting on the couch. Get up off the couch.
Okay.
And begin moving. That's the first step.
Okay. And notice he didn't say exercise. He says movement. It might just be doing something like this, but get moving, move the parts. If you don't use it, you lose it. Give us a call, 855-644-3278. We're Heart of Health Live, or you can give us a call at our website, heartwiseministries.org, or go to your Facebook page. You can get a hold of us. We're going to be right back talking to Susan. She has a question about stents, so stay with us. You might have the very same question. We're going to be right back with Dr. Ledford. Don't go away.
The Heart of Health Live will return in just a moment.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, everyone. If you just join us, we're talking about heart, specifically interventional cardiologist, big word. Dr. Sam Ledford is here. And Susan, you're on Heart of Health Live with Dr. Ledford. What is your question or concern?
Thank you for taking my call. I have a two-part question. First of all, my father-in-law recently had 3 stents placed, and naturally my husband is very, very concerned about this. And does this mean that he's going to be all right now, or can we anticipate that he's going to have more trouble? And the second part of the question is, what does this mean for my husband?
Okay.
So the first part is very important. Stents do not stents do not cure atherosclerotic or fatty plaque heart disease or vascular disease. They're a treatment. They're a means of opening a pipe and restoring blood flow to an area of the heart that's not getting blood flow. That same disease that led to that fatty plaque is going to produce others, and in time can even produce new fatty plaque within the stent once the vessel's healed. And so the key is just some of the things we've been talking about with people who've called in already and asked about how to reduce heart risk. He needs to reduce all of his risk factors. He needs to make sure that he's lowering his cholesterol. His cholesterol needs to be at levels it probably hasn't been at since he was a young boy. He may need medicines to help do that, but his diet becomes a key to that. Exercise, exercise, exercise if he can. Reducing other risk factors if he has high blood pressure. Really, really focusing on keeping his blood pressure in a normal range. And, as I said, if he has diabetes, and we mentioned this earlier, controlling his diabetes to the best degree possible. He needs to be in partnership with a great primary care physician to help him with all those things. Now, the second part of the question is, what's your husband's risk? Don't know the answer. And I don't mean that facetiously. Clearly, he may have inherited some of his father's genes. He may have an increased risk of developing fatty plaque. And so, the number one thing, if either of them are smokers, they absolutely have to get rid of tobacco in their life. If he has risk factors or already has high blood pressure, has high cholesterol, those are things he needs to begin to treat now to reduce his risk later. Now, did that answer the question? Any follow-up with that?
Well, so he could potentially have more stents.
Oh, absolutely. But now you have to remember, although I love nothing more in the world than going into the cath lab and opening up a blockage in a vessel, the second thing that I enjoy close to it is to see a patient back in a year and 5 years and 10 years and they have not needed another stent. They have not needed any other intervention because they've begun to treat those risk factors and they've lowered their chance of new fatty plaque disease and the need for stents. We have great medical studies that show, particularly with fatty plaque disease and with lowering cholesterol, that not only can we reduce the risk of need for new stents, reduce the risk of heart attack, we can actually see in these medical studies that the fatty plaques that are there can shrink and become less and become more stable to reduce the risk of heart attack, reduce the risk of stroke, and definitely reduce the risk of further stents. So it is not absolute that he will need more stents, but there is one guarantee. If he's smoking, if he's sitting on the couch like Dr. Marcum mentioned earlier with another example, he'll be back in the cath lab.
Yeah.
Oh, you sound negative. Don't be that way. We're optimistic here, but it takes a lifestyle change. There's no question about that. My patients who come in and see me who are smoking, and I beg them to quit smoking and they don't, I guarantee them. I give them my card and I say and tell them, I'll see you back later in the cath lab because you will be back again.
Wow.
Okay. Well,
all right. Well, you've given me a lot to think about. Thank you.
Now, the last thing that I mentioned to you is you have an important role with both of them. If you happen to smoke, we know that when parents, we know that when spouses work together with their husband, wife to quit smoking, that their likelihood of stopping smoking for the rest of their life is exceptionally higher. Sit down with your husband. A healthy diet is good for you, he and all of your family. The kids may not be excited about it, but you can make it reasonable for them.
Yeah, I think you made a great point there. The stent just treats a symptom.
Absolutely.
It doesn't get at the cause of the disease. And we want to get at the cause of the disease. And all these different stressors in your life, these risk factors we've talked about, are a cause of cardiovascular disease in addition to your genetics. We're going to have to go to break again, but we're going to be back after a break. Royce from South Carolina, you're on next with Dr. Ledford, who's also spent some time in South Carolina. So stay with us on Heart of Health Live. Go to our website, heartwiseministries.org. We're going to be right back after this short break.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Well, thanks for watching this evening, and we're humbled to be coming into your home. And remember, we are not a substitute for expert medical advice. We just give suggestions and give you something to think about, to talk to your doctor about. And if you haven't seen a doctor about your health, most people spend more time picking a bank or a grocery store than they do checking out their health. And what a valuable piece of property, I can't say property, but what a valuable gift you have in your health. So take good care of it. Now, Royce from South Carolina, you're on with Dr. Ledford, who also spent some time in South Carolina. Go ahead, Royce.
Yes, I wanted to ask you what would be the purpose a doctor would have for giving a heart patient that has 3-way bypass, cardiovascular surgery, Haldol, and how this would help the person to recover. How does the person react with that? Would they be foggy headed? Please tell me something about this so I understand.
Sure. So first, let me just clarify your question a little bit. Was the Haldol given while the person was in the hospital recovering from bypass surgery?
Yes, sir. 2 days after.
2 days after. So they were already home or in the hospital?
No, they were in the hospital.
Okay.
Okay.
So, Haldol is a sedative. It's a medicine to help calm people. It's very common after bypass surgery, particularly in the elderly patients, that there can be some confusion after any type of surgery.
Okay.
The last thing we want is for a patient to be exceptionally agitated. You can imagine how frightening the intensive care unit could be for someone when they first wake up after bypass surgery. Haldol, similar medicines can help take away some of the anxiety, some of the frustration, help calm them and relax them so suddenly they don't have these terrible stressors on their heart that we can potentially help prevent.
Oh.
Yeah.
Okay, that was my question.
Yeah. Well, thank you for calling.
Go Gamecocks.
There you go. Okay. You know what? I tell people after they've had any type of surgery on the heart, it's sort of like, if you broke your arm, you want to rest it, and we rest the heart by knocking down the nerves that might stress it, by knocking down the blood pressure, necking down. We can't put a heart in a cast, but we can rest it in other ways. And I guess this is another way. If there's a lot of anxiety, agitation, they can rest it with a sedative. Now, they won't have to be on it forever, will they?
Oh, no. These are short-term medicines typically used just in the hospital, just in the first couple of days after surgery. And again, you can imagine, if you could, that the last thing you remember is going into the operating room to have open heart surgery. You wake up and you're in a completely foreign environment, people you've never met before in the intensive care unit. No matter how nice, they're still strangers. You're having mild pain in your chest, you know you've had surgery, and everything is foreign to you. That's scary. And so, anything we can do to help relax you, calm you, make you feel at ease, we use. And sometimes medicines are the best thing to help with that.
And Dr. Ledford, you've just been medicine for her because she was clearly anxious about her husband being on Haldol, and you helped calm her down because now she sees the reasons. And unfortunately, there's so much medicine, sometimes all the questions aren't answered, and it takes time to get all the answers you need.
Oh, absolutely.
But the bottom line is keep asking questions. Don't be at home anxious about things. You can go to our website, you can call us up, we'll be happy to answer you. Let's go to another question here. This one comes into our website. It says, I recently had a heart attack and received a stent within 3 hours of the pain. Once a heart attack begins, how long does it take on average before permanent heart damage occurs? So this is a good one for getting in early.
So it's a great question, and it covers several different things that we really ought to cover. The first is, we use the adage, time is muscle. Every minute that you're having chest pain that's not relieved and or having a heart attack is a minute that the muscle can potentially die. The longer that you have the symptoms and they're not relieved, the greater likelihood that a larger portion, a larger area of your heart is going to be permanently damaged, die from the heart attack. The quicker that we can get you in and treat that, open that vessel, the better your outcome and the greater likelihood for recovery of heart function. The number one delay for treating heart attack patients in this country is not because they sit in the emergency room waiting. It's not because I have to drive in emergently from home to treat and open up your blockage. It's not because we don't have equipment. It's because you sit at home and wait, worrying, is this something else? Is this indigestion? The key is you decide early. If it's not right for you, you get in and be seen quickly. Again, time is muscle.
Well, that's great. So, there's a good chance if they got in within 3 hours from the onset of pain, there's a good chance that there might not have any muscle damage.
Absolutely, and we see this. There's no question that the longer the duration to open the vessel, the greater likelihood of long-term problems.
Now, would you say, in your opinion, is it easier to open the vessel the sooner they get in?
That's a variable question, but there's no question that there's data that even 2 to 3 days of continuous pain and heart attack, no benefit in opening the vessel at that point.
Well, stay with us. We're here with Dr. Ledford, interventional cardiologist. We're going to be back. Give us a call, 855-644-3278.
The Heart of Health Live will return in just a moment.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
Nice. Oh. Come on.
Oops.
Yeah, sure.
Let's go. Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Learning a little bit about their heart, how to stay healthy, and especially about stents. And we're here with Dr. Ledford, and if you don't have time to call us tonight, you can always go to our website, heartwiseministries.org, and leave a bunch of questions. And when we get enough questions in, we'll have Dr. Ledford come in again if he's willing. Or you can go to our Facebook page and be one of our friends and join the conversation every week. If you happen to have friends who might want to watch this program, it's going to be posted on our website, and you can watch it 3 or 4 times if you don't get all the points the first time. And we just want you to learn more, and if this is the way you learn, we're just glad you joined us this evening. We have a couple quick questions that we have to get to here. One of the questions is it true that there is a biodegradable stent available?
So the answer...
You mentioned this earlier.
The answer is mixed. There is one currently in research trials. It's not available to the general public.
Okay, so we don't know if it's going to be work yet.
Right, exactly, and that's the other key. We don't know how successful that's going to be. Some initial trials are we're very optimistic about some initial trials. We're beginning to enroll patients in clinical trials, and there are very specific criteria for those patients. So if your doctor says you need a stent, you may not be eligible for a biodegradable stent. A bioabsorbable stent, excuse me. Go see your cardiologist, talk with them about it. If they're talking about stents, and see if you're eligible for enrollment.
I remember years ago when I first started out in cardiology, we just did angioplasties. That's where we did the balloon. We didn't have a stent. And after I've been in practice for a while, the stents came out. And everyone goes, oh, those things are never going to work. Those things are not going to work. And yet, we've seen the second and third generation. They've been around a long time. They look like they've helped a lot of people.
We have seen that in the years as the interventional cardiology techniques have progressed, that complications related to the procedures have dramatically decreased as our equipment has gotten better. And we've seen that the number of heart bypass surgeries that are being done each year in our country have significantly declined with the use of these interventional procedures, which are less invasive.
Yeah, so there's some great emergency treatments, but the key is getting you in if you're having it.
Absolutely.
Don't stay at home if you're having symptoms. Another quick question we had, if you have a cardiac stent, can you undergo an MRI? So I guess we have to explain what an MRI is to them as well.
Sure. So magnetic resonance imaging. It's sticking your body into this big giant magnet and using a lot of physics that as a simple-minded cardiologist I don't completely understand. I rely on people much more brilliant than I, but it is able to perform very high definition images of the inside of the body in a non-invasive way. MRI uses a giant magnet. If you have large metal objects in your body, you know what a magnet does from back when we were kids in school. It attracts metal. That can cause damage to your body, internally, externally. And so, when the stents were first developed, the question was, could a patient go into an MRI magnet, the machine, and be imaged? And the answer absolutely is yes. In fact, we have had patients within minutes to hours after having a stent placed go in for another reason because they need their MRI to evaluate.
Okay, so the answer to that question is yes.
Again, like everything else, When you go in to see, to have your MRI, they're going to have you fill a metal screen out, a form that says these procedures and things I've done. Be sure and list you have a stent. Even though Sam Ledford told you it was okay, again, depending on the strength of the magnet, there may be some effects. These stents have been tested up to a certain level. Like every technology, MRI is improving. We know up to a 3 Tesla magnet. You don't have to worry about that number. Your radiologist will pay attention to that, but we know up to that level they're safe. We haven't tested beyond that.
Yeah, and also pacemakers. You know, that's something, you know, usually you can't get in.
Absolutely. Pacemakers, defibrillators right now, the great majority are not. You have a pacemaker defibrillator, you are not going to safely enter an MRI. There is a manufacturer currently that is making a MRI compatible pacemaker.
Yeah.
Again, like everything, the technology is improving. I suspect within a matter of years we're going to see that those devices potentially can go into magnets.
Wow. Here's another question. It says, what is the difference between Plavix and Effient? And exactly which one is better after I've had a stent? That's a great question.
So like everything in medicine, the question is difficult.
Yeah.
And I've got less than 1 minute to tell you. The bottom line is these medicines work through the same mechanism. They help prevent platelets, little tiny cells that float around in our bloodstream that are the beginning of a blood clot to form. They prevent platelets from forming in a newly placed stent. And so they reduce the risk of blood clot forming in stents. The medicines, medical studies suggest that one may be in some patients better than others. We have medicines, more than just Plavix and Effient now, that are coming onto the market. We don't have enough time to talk about the difference, but this is where especially it is an individual thing, and you need to visit with your cardiologist to discuss which would be best for you.
We can talk about that after the break a little bit more. Stay with us. We have a few closing comments. We're already getting to our last segment. Please stay with us. We're talking with Dr. Sam Ledford on Heart of Health Live. Our website is heartwiseministries.org. Don't go away. We're going to be right back with some closing comments.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
You've got questions? We've got answers on the Heart of Health Live. Welcome back.
Well, we're glad you've stayed with us throughout the program. We've talked about heart disease with Dr. Sam Ledford, and I hope you've learned something today. And the things that I want you to stay with us, if you have a question, ask questions. If you have symptoms, get help right away. And remember, practicing medicine is an art. You know, sometimes people will go out on a certain medication from a hospital and they won't be able to afford it. Well, I would much rather have taken maybe something that's not quite as good than not taking anything. And sometimes you just don't realize how important these medications are. Dr. Ledford, we want to thank you for joining us. And, you know, we have a couple minutes left, and I want you just to look out the camera and just sort of talk about what might be heavy on your heart today, something that you really want to give back to people.
The two things are, we can cure heart disease. We can change our lifestyle, we can change our diets, we can change bad health habits, and we can reduce the risk of heart attack, stroke, and overall heart disease in our country. Most women don't know this. There's a focus on breast cancer in our country. Breast cancer is not the #1 killer of women. It is heart disease. A fact that most don't know. In fact, more women die of heart disease than all other cancers combined in the United States. Risk factor modification, changing those things that increase our risk will help. The last thing I want to mention is, I have patients come in so many times, they ask for my advice. What do you think, Dr. Ledford? And then when I offer that to them, they say, well, I read on the internet. There's a reason .com is at the end of most internet URLs. I offer to you to get professional advice. You don't know who's writing on the internet.
Right.
There are very reliable sources, and there are some that are a guy hiding down in his basement just jotting some information to you. Go see your doctor. Go to a professional and get help. And lastly, if you think you're having a heart attack, early is better. Get in to see us. Come to the emergency room and be treated. Time is muscle.
Okay, well, thank you, Dr. Ledford. Thank you for spending time with us this evening.
My pleasure.
And thank you for allowing us into your home. And if you might have questions or want to watch this program again, you can go to our website, heartwiseministries.org. And we try our hardest to give good information. We're not selling a product. We just want to give you good information that you can discuss with your doctor so you can have a healthier, happier life. Join us each week on Heart of Health Live. Become a Facebook friend. We're glad you're joining us. And we're also glad that Dr. Ledford was with us here this evening. We're wishing you the best of health.